Now, if you're anything like me, you're fed up with our healthcare system. It costs too much, delivers too little, and feels rigged against you at every turn. In fact, a lot of Americans are feeling the same way, and many are looking for solutions. And guess what? Adam Conover thinks he's cracked the case. In his recent video, The Real Killer is the American Healthcare System, the self-proclaimed fact buster, that guy from Adam Ruins Everything, takes a swing at diagnosing America's healthcare woes and throws in a cheap hit on Robert F. Kennedy Jr. for good measure. Now, Adam means well, I'll give him that, but good intentions don't make up for misinformation, and his video is packed with emotional manipulation, selective facts, and logical fallacies that don't really stand up to scrutiny. He takes one extreme headline-grabbing story and spins it into a sweeping indictment of our healthcare system while mocking anyone with a solution that doesn't fit his partisan narrative as a conspiracy theorist. But here's the thing. Oversimplifying a complex issue and leaning on outrage isn't going to solve the problem. So today we're separating fact from fiction. Let's roll the tape and start unpacking this nonsense.
Americans are so furious about healthcare that they are straight up murdering CEOs in broad daylight. Every fact about the killing of United Healthcare CEO Brian Thompson is crazier than the last. Just to eliminate any doubt as to the motive, the shooter literally etched "deny, defend, depose" on the bullet casings, a reference to the tactics insurers use to deny healthcare claims. He left behind nothing but a bag full of Monopoly money, and then he disappeared on a city bike, and for 5 days he evaded the police like he was Jason frickin' Bourne. The only reason he got caught was because of this photo of his face, which was taken when he pulled down his mask to flirt with a receptionist. Dude was having a meet cute in the middle of a hit. Is this real life or the plot of a high-concept 90s rom-com? Well, the cops have now arrested this absolute hunk and charged him with murder. His name is Luigi Mangione, and someone's gotta call Nintendo because the year of Luigi is back, baby! Because instead of condemning this handsome hitman, the public loves this guy. He's become a virtual folk hero. I mean, just look at those abs. Can New York City even find 12 jurors willing to convict this dreamboat? That's 2 jurors per ab.
Let's get something straight. The claim that Americans are so furious about healthcare that they're straight up murdering CEOs in broad daylight is pure nonsense. It sounds dramatic, like some dystopian uprising where insurance executives are dodging sniper fire between board meetings, but when you actually look at the facts, just for a second, you realize how absurd it is. There's no wave of violence. What we have is one incident involving one man, Luigi Mangione, and a story that has been twisted beyond recognition to fit a hyped-up leftist pro-universal healthcare political narrative. Now let's start with the most basic fact. This is the first case of its kind in U.S. history. That's right, despite decades of Americans being absolutely livid about premiums, denied claims, and medical bankruptcy, there's been no trend of violence against healthcare executives. None. This isn't a revolution, it's an outlier. The Bureau of Labor Statistics tracks workplace violence, and while healthcare workers, nurses, doctors, EMTs are at high risk for assaults, executives, not even close. If this were an actual uprising, there would be data, headlines, patterns. Instead, we have Luigi Mangione, and his story doesn't hold up, even under the lightest scrutiny. Here's what you won't hear from anyone spinning this into a grand act of rebellion. Luigi wasn't even insured by United Healthcare, the company whose CEO he allegedly targeted. According to Reuters, Luigi had full coverage through a completely different insurer. So much for the idea that this was some kind of last straw after being personally screwed by the system. It wasn't. The United Health angle is just narrative padding to make this sound like a symbolic act, when in reality it's a tragedy fueled by something far messier. Luigi Mangione wasn't acting out of calculated rage about healthcare. According to the Associated Press, investigators have strong evidence that what he did was the result of a psychotic break, likely exacerbated by months of heavy psychedelic drug use. Mangione had disappeared for months leading up to the incident. His family couldn't contact him, couldn't find him. Authorities even found evidence that he'd been obsessively reading Ted Kaczynski, the Unabomber, someone whose anti-modernity ramblings tend to resonate with people spiraling into delusion. And let's not ignore the absurdity of framing Mangione as some sort of working-class hero. According to the New York Post, the man went to a $40,000 a year prep school, the kind of place that churns out hedge fund managers and corporate executives, not torch-wielding revolutionary. This wasn't a story of systemic oppression pushing a man to the brink. It was a story of privilege, mental health decline, decline and a personal collapse being twisted into a symbol of something it never was. All that being said, the idea that Mangione is some Jason Bourne-style folk hero standing up to the healthcare system is pure fantasy. This myth-making doesn't solve anything. Turning Mangione into a folk hero distracts from the legitimate problems in our healthcare system and replaces productive conversation with sensationalist theater. People are more interested in Mangione's abs and dramatized escape than they are in serious policy reform. And let's be clear, at no point has anyone offered a real, balanced solution here to the healthcare problem. The loudest voices are simply far-left lunatics fantasizing about universal healthcare, which is a controversial solution.
Now, the public reaction to the murder is unsettling to some people, because, normally when someone is shot dead in broad daylight, people are afraid and demand justice. But health insurance companies are so hated in this country that Americans from all walks of life have actually been celebrating the murder. A Facebook post by United Healthcare about the shooting has gotten over 80,000 reactions, and over 75,000 of them were ha ha. I mean, imagine you're shot dead in the street and 70K Nelson Munces point at you and laugh. Even nurses and doctors, whose entire job is to, stop people from dying, are enjoying this particular death. A thread on Reddit's r/medicine had to be deleted because it had too many inappropriately gleeful comments. And it's not just the libs cheering. Even r/conservative and the comments on Ben Shapiro's YouTube videos are going nuts right now. Hating health insurers is the last bipartisan issue in America. Now look, I know that to the more genteel soul, the New York Times op-ed columnists of the world, it might seem disturbing to see your fellow citizens react to a murder with delight and glee. But instead of shushing this outburst, I think this needs to be taken as a warning. Because Americans are saying loudly and unequivocally that we are fucking pissed about healthcare in America, to such an extent that we are now literally excited for murder.
So let's break this down piece by piece, because what's being presented here isn't just sloppy, it's downright irresponsible. The argument essentially boils down to, look at these posts, these comments, these unverified reactions online. Americans are so mad about healthcare that they're openly celebrating murder, and this proves we're at a breaking point. Now, on the surface, that's a provocative claim. It fits right into the neat little narrative about America's healthcare crisis. First off, let's talk about the evidence, or more accurately, the lack of it. The reactions being cited here are almost entirely anecdotal. A Facebook post, a Reddit thread, comments under a YouTube video. These are open forums. Anyone can post and anyone can brigade, meaning organized groups can flood these spaces to amplify a certain narrative. Ever heard of a troll farm? Or, the very real practice of brigading, where users from forums like 4chan or Discord coordinate to flood comment sections with specific messages just to make it look like everyone thinks a certain way. If you take unverified internet comments as evidence of public sentiment, you're not analyzing, you're being played. And here's a kicker. You can't verify the political leanings of these people. Are they libs or are they conservatives? Are they even American? Who knows? There's no voter registration on Reddit. Facebook reactions don't come with party affiliations. But sure, let's trust that anonymous posters saying LOL good riddance are a representative sample of the entire US population. Now here's a more nuanced and fact-based look at American sentiment about healthcare. A 2024 Talker research survey found that 81% of Americans feel their healthcare providers listen to their concerns, reflecting a strong level of satisfaction with doctor-patient relationships. Additionally, 66% felt heard and respected by their doctors, showing that trust in healthcare professionals remains high. A 2023 Harris poll revealed that 72% of Americans are satisfied with the quality of the care they receive personally, and 70% trust their primary care physicians to make the right decisions for their health. Moreover, 84% of insured Americans say their health insurance gives them access to the care they need, according to a 2024 AHIP report, showing confidence in the availability of individual services when coverage is in place. Now, all that being said, this confidence doesn't extend to the system as a whole. A December 2024 Gallup poll found that 44% of Americans rate healthcare quality as excellent or good, the lowest in 44 years. At the same time, only 19% are satisfied with healthcare costs, highlighting widespread frustration with affordability. A separate survey from the Economist YouGov revealed that 54% of Americans hold an unfavorable view of the healthcare system, compared to just 36% who view it favorably. These numbers show that while Americans value their individual care, dissatisfaction with a broader system, particularly its costs, remains both widespread, and deeply entrenched. But here's where things actually fall apart. Jumping from people are angry about healthcare to the country is cheering for murder isn't just bad logic, it's a rhetorical farce. Internet mobs and their pitchfork rallies do not reflect reality. They reflect amplified outrage, not the nuanced, widespread dissatisfaction Americans feel. If we want to understand how people really feel about healthcare, we need to rely on credible data, not Reddit threads and cherry-picked comments designed to provoke. And let's talk about the glaring fallacy here. It's all a hasty generalization. Adam is cherry-picking internet comments from the most unhinged corners of the web to extrapolate them into all of America. That's like saying one crazy seagull stealing your sandwich means every bird on Earth has declared war on mankind. It's lazy, it's inflammatory, and it completely ignores the nuance of public sentiment. But here's a part that really gets me. This kind of narrative doesn't help. It does nothing to solve the very real problems Americans face in healthcare. We all know the system is broken. Premiums are insane. Medical debt ruins lives, and millions go without care because they just can't afford it. People are angry about that, and rightly so. But sensationalizing this anger into some murder-happy revolution distracts from the actual conversation we need to have. Instead of policy solutions, we get outrage porn. Instead of addressing root causes, we turn a mentally ill man's actions into a folktale. Because there are people out there who are genuinely trying to spin this into some populist uprising, but we have to remember, Luigi Mangione didn't even experience the systemic failures he supposedly represents.
And if you actually take that in and internalize it, it explains a lot about our society, including the popularity of Donald Trump's favorite parasite-infested anti-vaxxer, Robert F. Kennedy Jr., and it illuminates how the American health system's deep dysfunction is causing our entire society to literally break down in a way that the establishment needs to reckon with before it is too late.
And here's where Adam's cheap pivot to RFK Jr., or as Adam calls him, Donald Trump's favorite parasite-infested anti-vaxxer, enters the scene. You got to admire the rhetorical efficiency here. A loaded insult that includes an ad hominem attack and a sweeping dismissal of any skepticism about the medical establishment. But here's the thing, whether you like RFK Jr. or not, dismissing him as nothing more than an anti-vaxxer ignores the nuance of his positions and the reasons some Americans resonate with his skepticism. You don't have to agree with him to recognize that calling half the country conspiracy theorists is lazy and counterproductive. People distrust institutions like Big Pharma and the healthcare system because those systems have failed them. Slapping a label on RFK doesn't fix that distrust. It just signals to Adam's audience that anyone questioning the status quo is fair game for mockery. And let's talk about Adam's framing of the healthcare system itself. Look, we can all agree that the U.S. system has problems. It's expensive, it's inefficient, and people are rightly frustrated. But Adam's analysis isn't a critique, it's a performance. He uses buzzwords like dysfunction and societal breakdown while offering zero substance, zero context, and zero solutions. For example, why is healthcare so expensive? It's not because some CEO twirls his mustache and denies claims for sport. It's a complicated mess of inflated administrative costs, a lack of price transparency, and misaligned incentives baked into the system for decades. And let's not ignore how over-regulation has played a key role in distorting the marketplace. The Affordable Care Act, aka Obamacare, for instance, mandated a series of essential health benefits and imposed community rating rules, which effectively prohibited insurers from pricing plans based on individual risk. While the intentions may have been noble, the result was skyrocketing premiums for many Americans, especially for those who don't qualify for subsidies. According to the Heritage Foundation analysis, between 2013 and 2019, premiums for individual plans on the ACA exchanges more than doubled, a 129% increase nationally. This overregulation didn't solve the problem of affordability. It just passed the costs onto consumers while limiting competition in the marketplace. Even the Centers for Medicare and Medicaid Services reported that average premiums surged significantly during the ACA's rollout, making affordable coverage even harder to access. Now, instead of addressing these root causes, Adam resorts to emotional manipulation, dramatizing anecdotes and painting CEOs as cartoon villains because that's easier. And let's be honest, it sells better.
Now, a lot of commentators and CEOs out there are wringing their hands about the celebration over Brian Thompson's death. But the anger actually makes perfect sense if you just look at United Healthcare's business model. This company made $22 billion in profit last year. Not revenue, pure profit. And they got that money by denying people care. United has the highest denial rate of any health insurer. They deny 1 out of every 3 claims. They've recently been investigated by the Senate for denying claims of elderly and disabled patients with the explicit intention to increase their profits. And they're even being sued for using an AI algorithm to process those denials. So Brian Thompson wasn't an upstanding businessman. He was a mafia boss, standing in between doctors and patients who made his millions by bankrupting people and letting them die. He may never have held a gun directly to someone's temple, but that doesn't mean he wasn't a killer.
All right, let's break this down line by line, because this is exactly the kind of half-baked outrage wrapped in emotional manipulation that passes for analysis these days. First, let's tackle Adam's claim that United Healthcare made $22 billion in profit last year, not revenue, pure profit, he says. Now, yes, United Healthcare reported $22.4 billion in operating profit for 2023, but here's a context Adam conveniently leaves out. United Healthcare operates under United Health Group, a massive conglomerate that includes Optum, its health services subsidiary. Optum contributes a significant chunk of these earnings through pharmacy benefit management, care delivery, and data services, not just insurance. United Healthcare's insurance branch itself doesn't hoard all that cash by denying care. According to United Health Group's own annual report, Optum accounted for more than half of the operating earnings in recent years. Pretending this money all comes from denied claims is flat out dishonest. Adam is simplifying a complex financial statement to fit his narrative, but it's fundamentally misleading. Next up, Adam claims that United has the highest denial rate of any health insurer, rejecting 1 of every 3 claims. Where's the source for that? Spoiler alert, there isn't one. In fact, if you look at his video, he only shows a headline, never actually shows a figure. In reality, claim denials are a problem across the board, but data varies depending on plan types and regions. The Kaiser Family Foundation found that 17% of in-network claims in the ACA marketplace plans were denied in 2021, not 33%. Further, most denials are due to coding errors, lack of documentation, or out-of-network issues, not insurers twirling their mustaches and plotting how to deny grandma's dialysis. This blanket statement makes United look like the big bad wolf when the entire system struggles with administrative inefficiency. Then Adam trots out the Senate investigation, again with no specifics. What he's likely referencing is a 2022 Senate Finance Committee report that scrutinized Medicare Advantage plans for improper claim denials. While United Healthcare was indeed criticized in that report, they were far from the only insurer named. Humana, Aetna, and others were also flagged for similar practices. And yes, AI systems were mentioned, but guess what? Automating claim reviews is common across insurers because the sheer volume of claims makes manual processing impractical. When errors are found, regulators intervene. That's the system working, not proof of a company's moral bankruptcy. But here's where Adam really goes off the rails, equating Brian Thompson to a mafia boss and branding him a killer. Let's get something straight. Criticizing a business model is one thing. Demonizing individuals is another. It's not denying care when insurers refuse to cover procedures outside of policy terms, no matter how frustrating that is for patients. Insurers are businesses operating within a broken system where costs are skyrocketing thanks to hospital price gouging, lack of transparency, and regulatory mandates that inflate premiums. And let's remember, the Affordable Care Act imposed essential benefits requirements that drove costs through the roof for insurers, forcing stricter controls on what's covered. If Adam wants to play judge and jury, maybe he should look at how regulation has made U.S. healthcare so expensive in the first place. Oh, and one more thing. This whole narrative about insurers bankrupting people and letting them die, that's pure emotional manipulation. Medical bankruptcies in the U.S. are a real tragedy, yes, but they're overwhelmingly caused by out-of-pocket costs, uninsured expenses, and surprise billing, not denied claims alone. A 2024 JAMA study revealed that most medical bankruptcies stem from people being underinsured, which isn't just an evil insurer problem. It's a system-wide failure that includes hospitals, pharmaceutical companies, and government policies. Adam's overall framing here is a classic appeal to emotion. Throw out exaggerated claims, toss in a sinister metaphor, and let the outrage roll. But good analysis relies on facts and context, not lazy villainizing. Does the U.S. healthcare system need reform? Absolutely. But pinning it all on a single CEO and spinning financial data into a headline-grabbing tirade does nothing to solve the problem. It's cheap, it's irresponsible, and frankly, it's beneath someone who calls themselves a fact buster. If Adam really wants to fight for real solutions, let's talk about tackling administrative waste, transparency in pricing, and addressing the overregulation that strangles competition in the marketplace. But until then, let's leave the mafia boss rhetoric to Hollywood.
In America, you are twice as likely to die from lack of health insurance than a bullet to the head. An NIH study in 2021 estimated that universal healthcare coverage could save 68,000 lives a year. 68,000 lives. That means just this year, insurance companies like United Healthcare are responsible for enough dead bodies to fill the city of Flagstaff, Arizona. And Brian Thompson was personally paid $10 million a year for standing atop that system of death. The American people see that, unsurprisingly, as fundamentally unjust, unfair, and fucked up. And so they are cheering for his death.
Okay, let's start with Adam's shocking claim. You're twice as likely to die from lack of health insurance than a bullet to the head. Catchy, sure, but it's also wildly misleading. The study he's referencing doesn't prove that lack of insurance causes death. It's correlation, not causation. The study shows that people without insurance often face worse health outcomes because they can't afford care. That's a tragedy, no doubt. But here's the thing. Adam conveniently mischaracterized the study, which shows that insurance itself isn't the problem. It's the cost of care that's broken. Adam blames insurance companies because they're an easy target, villains with deep pockets and bad PR. But pointing at insurers while ignoring the skyrocketing costs set by hospitals, drug companies, and layers of regulation is like blaming a raincoat for the flood. The system is expensive and inefficient because everything upstream is out of control, and premiums are just a reflection of that chaos. If we want to talk about saving lives, let's start there, not with cheap outrage and lazy scapegoating. Now, Adam really cranks up the drama with his next line. 68,000 lives lost every year, enough to fill the city of Flagstaff, Arizona. First of all, it's cute how Adam cherry picks Flagstaff, which appropriately has a population of 68,000 for dramatic effect. It's not about informing you. It's about creating an image so jarring, you don't stop to question it. But let's get this straight. The 68,000 deaths claim stems from a 2020 Yale study published in The Lancet that models potential lives saved if universal coverage existed. Fine. But here's what Adam skips. Health outcomes in countries with universal systems aren't perfect either. The UK's National Health Service routinely sees delayed care due to resource rationing, with thousands of excess deaths linked to treatment delays each year. Canada's single-payer system, patients often wait months for critical procedures like MRIs or joint surgeries. So no, universal coverage isn't a magic bullet that suddenly eliminates mortality. It just shifts where the inefficiencies lie. Now let's look at what's been happening as far as universal health care stateside. Massachusetts, the birthplace of Romney Care, the model for the Affordable Care Act, aka Obamacare. While the state achieved near universal insurance coverage, costs skyrocketed. Per capita health care spending in Massachusetts is up 15% higher than the national average, and premiums, they just keep climbing. According to a study from the Blue Cross Blue Shield of Massachusetts Foundation, reform didn't fix the underlying cost problem. It just masked it by expanding insurance. Then there's California, where dreams of a single-payer system keep crashing into a brick wall called math. In 2017, analysts estimated that California's Healthy California single-payer proposal would cost a staggering $331 billion annually. That's right, double the state's entire budget. Financing it would have required massive tax increases, a reality so politically and economically unworkable that state lawmakers abandoned the plan. That's not my opinion. That's from a detailed analysis led by economists at the University of Massachusetts Amherst and reported by Politico. Now, to take this a step further, though both states are often held up as models for high insurance coverage, the story remains the same. Massachusetts boasts over 97% of residents insured. Yet, a 2023 report from the Center for Health Information and Analysis found that 41% still struggle with healthcare affordability, skipping appointments and treatments because costs are sky high. Meanwhile, in California, where Covered California has expanded coverage, premiums are still surging, set to rise 9.6% in 2024 alone, the biggest jump in years. So sure, subsidies soften the blow, but they don't fix the root problem. Healthcare costs keep skyrocketing thanks to bloated hospital charges, rising care prices, and systemic inefficiencies. Both states prove the same point. Universal coverage doesn't mean affordable care. Instead of tackling inflated costs, the price burden burden just shifts to taxpayers, leaving families squeezed whether they're paying out of pocket or through ever higher taxes. Until we fix the real culprits, hospital pricing, lack of transparency, and broken incentives, expanding coverage will just mean bigger bills, no matter who's footing them. Anyway, back to Adam. He later brings out his favorite villain, insurance companies, specifically United Healthcare and its CEO, Brian Thompson. He frames it like Thompson is twirling his mustache on top of a system of death, pulling strings to deny care and rake in millions. This is where the straw man kicks in. Yes, United Healthcare reported billions in profits, and Thompson was paid handsomely, $10 million a year. But here's the truth. Profits aren't stolen from dying patients. United Healthcare operates in a for-profit model under the constraints of government regulations and a bloated system rife with inefficiencies. The real culprits driving up costs: out-of-control hospital pricing, pharmaceutical monopolies, and government mandates that drive premiums through the roof. According to the Kaiser Family Foundation, over 40% of medical costs come from hospitals alone, where the price tag for the same procedure can vary by thousands of dollars depending on the location.
Now, let's be clear. Thompson's death is not going to change the American healthcare system for the better. There's already some other suit sitting in his chair signing off on more denials. And rather than change their ways, his fellow CEOs are busy hiring private armies to protect them from their own customers. It doesn't make the world a better place when people are gunned down in the street for any reason. And there's a lot of justifiable concern that this could lead to even more political violence in our culture, which would be a bad thing. But we have to acknowledge that this killing and the reaction to it are evidence of how our system is failing us. Healthcare is a fundamental human need. And when people live under a system that denies their fundamental needs for too long, they start tearing that system down. I mean, it just makes sense. If you put people under that amount of stress, it provokes a reaction. One reaction might be shooting a healthcare CEO in the head, and another might be putting an insane conspiracy theorist in charge of our nation's health.
Let's get one thing straight. Thompson's death, like all acts of senseless violence, isn't going to fix the American healthcare system. And pretending otherwise is a kind of twisted logic that replaces reality with narrative theater. The claim here that gunning down a CEO is somehow a warning sign or even an inevitable outcome of a failing system might sound compelling, but it's riddled with sloppy reasoning, dangerous rhetorical leaps, and an unhealthy amount of misplaced romanticism. First off, let's address the core implication that this murder is a reasonable reaction to a broken system. No, it's not. It's a crime. It's not a revolution. It's not a protest. And it's certainly not the first rumblings of some populist uprising. The truth is far less glamorous. This was the act of one mentally ill individual, a man whose documented history of psychotic breaks and obsession with conspiracy theories. Yes, Ted Kaczynski's writings were found amongst his belongings. We just mentioned this earlier. It paints a far clearer picture than any tortured attempt to tie this to systemic outrage. Pretending otherwise is not only dishonest, it's dangerous. It turns a murderer into a martyr and distracts from the real solvable issues within our healthcare system. The rhetorical trick here is easy to spot. It's an appeal to inevitability. This idea that when people are pushed too far, violence becomes the natural, understandable outcome. Look, there's no denying that America's healthcare system is deeply flawed. Costs are obscene. 43% of adults struggle to pay their medical bills, according to the 2023 Kaiser Family Foundation. We're talking about real suffering here that deserves real solutions. But to take that suffering and suggest it justifies murder, that's not analysis, it's glorified nihilism. And while we're at it, let's talk about this tired private armies line. It's a kind of vague, sinister framing that sounds dramatic, but it doesn't actually mean anything. Are CEOs increasing security in response to a high-profile shooting? Probably. Most likely, anybody in good conscience would. That's not some nefarious conspiracy, it's just common sense. You don't have to like corporate executives to admit that people tend to take precautions when someone in their exact job just got shot in the street. It's not evidence of a collapsing system. It's evidence that people respond to threats of violence. Shocking, I know. But here's where the argument really falls apart. None of this leads to solutions. Turning a healthcare CEO's murder into a symbolic act of rebellion doesn't fix the cost of insulin. It doesn't expand access to care. It doesn't address predatory billing or medical bankruptcies. What it does do is feed a culture of outrage, where people are more interested in cheering for pitchforks than pushing for policy. And let's not pretend this narrative exists in a vacuum. It's a perfect example of the false dilemma fallacy. The idea that our only options are violent chaos or letting an insane conspiracy theorist run the show. Really? Those are the only choices. There's no room for thoughtful, measured reform. No space for targeted fixes to a system that, yes, is failing millions of Americans. Look, anger at the healthcare system is justified, necessary even, but romanticizing violence as the inevitable result of that anger does nothing to fix the problem. It takes a conversation we need to be having and drags it into the gutter of performative outrage. Because here's the truth, Thompson's death changes nothing. As Adam pointed out, there's already some other suit sitting in Brian's chair, signing off on the same spreadsheets. That's not because the system is untouchable. It's because murder doesn't lead to change. Solutions come from hard, unglamorous work. Reforming insurance practices, expanding coverage where it's needed. None of that happens when you're busy mythologizing a shooter and pretending chaos is the only path forward.
One reaction might be shooting a healthcare CEO in the head, and another might be putting an insane conspiracy theorist in charge of our nation's health. So when Robert F. Kennedy Jr. was nominated to run the Department of Health and Human Services, the medical community reacted with shock. And I get why. I'm gonna lay off the stuff about his brainworm and him eating dead dogs and bears and the whale head in his car and just focus on his actual beliefs for now, because those are somehow even crazier. I mean, this guy thinks that 5G cell signals are controlling our behavior, that antidepressants cause mass shootings, and that chemicals in the water are turning kids trans. Okay, dude, we know it's not water that makes kids trans, it's repeated viewings of seminal classic The Matrix. I mean, this guy has never met a bullshit conspiracy theory he didn't fall for. But his worst ideas are about vaccines. RFK Jr. has said that vaccine scientists should be in jail, that vaccines cause autism, which they do not, and even that COVID-19 was genetically engineered to be racist. And this is the man who's about to run the Department of Health and Human Services, which doesn't just handle vaccines, it's responsible for all of America's health.
Adam is clearly dodging the real debate about RFK Jr.'s ideas by relying on cheap shots about conspiracies, brainworms, and dead animals. That's not an argument. It's rhetorical fluff designed to sidestep RFK's actual ideas. So let's cut through the noise and focus on the real issue, what RFK Jr. actually represents and why having a skeptic like him leading the Health and Human Services could, believe it or not, be productive and a necessary move. First, let's get something straight. Skepticism is not a bad word, especially in science. In fact, skepticism is what makes science work. The entire scientific process is built on challenging assumptions, testing hypotheses, and welcoming dissenting voices to make sure we're getting things right. And here's where RFK matters. He's a disruptor. Institutions like the CDC, the FDA, and the NIH are massive bureaucracies. And bureaucracies, no matter how well-intentioned, can stagnate. They can become echo chambers, dismissing criticism and doubling down on their own blind spots. Bringing in someone like RFK Jr., a vocal critic of these systems, forces them to engage with questions they might otherwise ignore. Now let's talk about transparency, a buzzword every government agency loves to throw around but rarely delivers on. RFK Jr. has spent years highlighting concerns about regulatory capture, where government agencies tasked with overseeing industries end up serving the interests of those same industries. And before anyone dismisses this as conspiracy nonsense, let's remember the facts. In 2016, a report from BMJ, formerly the British Medical Journal, exposed widespread conflicts of interest in the FDA approval process for new drugs. In that same year, a study published in Science found that nearly 40% of FDA advisory committee members had financial ties to pharmaceutical companies whose products they were reviewing. This isn't tinfoil hat stuff. It's a legitimate problem. RFK Jr.'s willingness to address it could force these agencies to clean house, improve transparency, and rebuild public trust. And speaking of trust, let's not pretend it isn't a problem. Confidence in American public health institutions have cratered. A 2022 Gallup poll showed that only 44% of Americans trust the CDC, down from 64% just a couple of years ago. People are skeptical of the system because they feel it's not listening to them, not serving them, and not holding itself accountable. That distrust didn't come from nowhere. It's the byproduct of mixed messaging, lack of transparency, and growing influence from corporate interests. Bringing in a skeptic like RFK doesn't just acknowledge that mistrust, it's a signal that these concerns are being taken seriously. For the Americans who feel unheard, who feel shut out of the system, RFK represents a voice that challenges the establishment narrative. Now, to be clear, skepticism doesn't mean throwing out science. It doesn't mean giving equal weight to every wild idea. And RFK has said some things that deserve scrutiny. Fine, let's have that scrutiny. But dismissing him entirely ignores the productive role skepticism plays in scientific progress. History is full of moments where dissenting voices challenged conventional wisdom and improved the system as a result. Remember when doctors thought stress caused ulcers? Barry Marshall and Robin Warren proved it was H. pylori bacteria because they refused to accept what everyone knew. Skepticism doesn't undermine science. It strengthens it by forcing us to defend what we know and fix what we don't. And here's the thing, even if RFK's skepticism doesn't lead to sweeping policy changes, his leadership could still force much needed reforms. Greater transparency in clinical trials, stricter rules around conflicts of interest, better communication with the public about how decisions are made and why. These are real, tangible improvements that RFK has been demanding for years. You don't have to agree with every single thing he's ever said to recognize that he's asking questions the system needs to answer. The alternative, doubling down on the status quo, on institutions that have lost the trust of half the country and refuse to engage with their critics. That's not leadership, that's complacency. RFK may not be a conventional choice for the HHS, but maybe that's the point. Maybe the system needs someone willing to push back, ask hard questions, and challenge the entrenched interests that have been calling the shots for too long, because science doesn't advance when everyone agrees. It advances when someone dares to say, prove it. So let's skip the cheap jokes about brainworms and dead animals. The real debate here isn't about RFK Jr.'s quirks. It's about whether we're willing to let a disruptor force a system to confront its own flaws. If the goal is to improve public health, rebuild trust, and hold institutions accountable, maybe we need someone who isn't afraid to question the answers we've been given.
HHS is the largest department in the federal government. It includes the CDC, which is in charge of public health, including pandemics, the FDA, which makes sure your food and drugs are safe to consume. And you can debate whether or not those departments have done a great job in the last few years, but he's also going to be in charge of the National Institutes of Health, which is simply one of the best things that the federal government does. We covered this on my Netflix show, The G Word, but the NIH is the largest and most important medical science organization in the world. They're responsible for countless incredible discoveries that have saved countless lives. They invented chemotherapy, which, has saved lives of my own family members, as well as gene therapy and the mRNA vaccine, one of the most profoundly powerful medical discoveries of our lifetime. Because of the NIH, we as a species literally learned how to write code for our own immune system, then programmed it to fight back against a virus it had never encountered, and then deployed it to save millions of lives during the COVID pandemic. That is a fucking historic scientific achievement. It's Jonas Salk put it on the Mount Rushmore of medical science shit. And the department that created it, the most important funder of science in the world, is about to be run by a science denialist who thinks we should ditch vaccines in favor of ivermectin and raw milk.
All right, let's clarify this myth right out the gate. The NIH didn't single-handedly create chemotherapy, gene therapy, or the mRNA vaccine. Saying that is like giving the guy who held the latter credit for painting the Sistine Chapel. The NIH is undeniably one of the world's most important funders and facilitators of medical research, no question about that, but it's not the sole architect of every major breakthrough. It's a partner, a financier, and a catalyst in the process that involves scientists, universities, private companies, and collaborative global efforts. Let's start with chemotherapy. The origins of chemotherapy go back to World War II, when scientists noticed that exposure to mustard gas suppressed white blood cell counts. That observation eventually led to the development of nitrogen mustard as the first chemotherapy drug. This work was carried out by researchers at Yale, not by the NIH. Did the NIH fund and advance cancer research in the subsequent decades? Absolutely. They've played a massive role in scaling up clinical trials, refining treatments, and improving patient outcomes. But to say they invented chemotherapy erases the contributions of countless individual scientists, institutions, and observations made well before the NIH even entered the picture. Now let's look at gene therapy. Gene therapy emerged from breakthroughs in molecular biology and genetics during the 1970s and 80s, driven largely by discoveries made in academic and private research labs. The NIH funded much of this research because that's what it does. but it didn't create gene therapy. For example, the first successful gene therapy trial in 1990, which treated a young girl with severe combined immunodeficiency, was conducted at the NIH Clinical Center, sure, but it relied on decades of work in genetics, virology, and immunology from scientists across the globe. The NIH was part of the process, not the inventor of the concept. And then there's a big one, the mRNA vaccine. This one really gets thrown around as the NIH's crowning achievement, but the reality is far more collaborative. The technology behind mRNA vaccine starts decades before COVID-19. Hungarian scientist Katalin Karikó and her collaborator Drew Weissman at the University of Pennsylvania were the first to figure out how to modify mRNA to make it stable enough to work in humans. That was in the early 2000s, years before the NIH got involved. What the NIH did do, and this is important, is fund critical work on spike protein structures, which helped Moderna and Pfizer rapidly develop their vaccines. The NIH also partnered with Moderna on clinical trials and distribution logistics during the pandemic. So yes, the NIH was essential in bringing the vaccine to the public, but the foundational research, that came from independent scientists, academic institutions, and private companies. Now here's the crux of the issue. The NIH is a funding powerhouse. It provides grants, infrastructure, and resources that allow groundbreaking research to happen. It amplifies and accelerates innovation. But claiming that the NIH itself invented these breakthroughs is misleading and ignores the deeply collaborative nature of science. Discoveries like chemotherapy, gene therapy, and mRNA vaccines happen because of thousands of researchers across disciplines, often for decades, with funding across multiple sources: government, private sector, and academic institutions. Now, the NIH, like any massive bureaucracy, isn't perfect. Are we really pretending there's no room for improvement? That every grant, every research priority, and every partnership has been flawless? A leader like RFK Jr., someone unafraid to demand accountability and transparency, might actually strengthen the institution. And here's a kicker. Being a science skeptic is not the same as being anti-science. RFK Jr. isn't arguing that we should abandon medical research. He's arguing that we should scrutinize it, particularly when it intersects with corporate interests or flawed regulatory processes. Now let's address the rhetorical sleight of hand happening here. The argument trots out gene therapy and the mRNA vaccine as if RFK Jr. is about to barge into the NIH and set fire to every lab. That's appeal to fear, a classic move designed to scare the audience into thinking that questioning any part of the system means you want to burn the whole thing down. But RFK Jr.'s concerns about vaccines, for instance, don't mean he's advocating for a return to the Stone Age. Yes, he's criticized vaccine safety. You can disagree with him, and you should when the evidence says otherwise. But pretending that his skepticism is synonymous with denying all science is lazy and dishonest. And speaking of lazy arguments, let's talk about the ivermectin and raw milk line. This is straw manning at its finest, taking the most outlandish versions of RFK Jr.'s views, inflating them, and using them to discredit everything he stands for. Has he criticized the over-reliance on pharmaceutical solutions? Yes. Has he advocated for broader conversations about alternative treatments? Also yes. And while some of his ideas deserve pushback, the implication that he's pushing snake oil while trying to kill the NIH is just nonsense. If you want to argue against him, do it honestly. Show where his views are flawed. Engage with the actual evidence. But smearing him as some lunatic who prefers milk over medicine, that's not an argument. It's a punchline. Here's the bottom line. RFK Jr.'s leadership doesn't spell the end of the NIH, the CDC, or the FDA. What it could do is force these institutions to confront long-ignored issues like regulatory capture, where agencies become too cozy with the industries they're supposed to regulate. Instead of resorting to hyperbole and fear-mongering, we should be asking how someone like RFK Jr. can challenge these institutions to be better. How can his skepticism, when constructive and evidence-driven, lead to reforms that benefit everyone? Skepticism isn't a threat to science. Blind loyalty to institutions that refuse to evolve is the real danger.
And if he succeeds in that, if he succeeds in convincing Americans to ditch vaccinations in favor of pseudoscientific quackery, it could lead to mass deaths. Measles is one of the most transmissible and deadly diseases, and we used vaccinations to virtually eradicate it in the US. But when we stop vaccinating against measles, that shit comes back. And a measles outbreak could quickly infect, disable, and kill millions of children. Vaccines are good and important, and they have saved hundreds of millions of lives around the world. And anyone who tells you otherwise is either crazy or lying. But you know what? I don't even know why I'm telling you this, because I have spent my entire career as a comedian and communicator trying to dispel myths and conspiracy theories exactly like these, and it hasn't fucking worked. It's just made me look like a condescending nerd. And you know what? It's not just me. A small army of science communicators have desperately spent the past few decades trying to combat medical misinformation like this, including people at the CDC and NIH. And they have failed so thoroughly in that goal that their boss is about to be the king of the anti-vaxxers. After all of our debunking, Mr. Bunk is in fucking charge. And that means he will now have the platform and the full legitimacy of the American government behind him as he attempts to fulfill his mission of giving every single American brainworms. And unfortunately, Americans are already primed to believe misinformation like this because of the media silos we live in.
All right, let's start with the fear-mongering. Spoiler alert, the sky is not falling. Now, Adam's argument paints RFK Jr. as a dictator in waiting who, upon entering office, will dismantle vaccinations and hurl us into a plague-ridden dystopia. Newsflash, that's not how the U.S. government works. HHS is not a monarchy. RFK Jr. or anyone else in that role doesn't have the power to unilaterally overturn vaccination policies, rewrite public health guidelines, or dismantle programs like the CDC's immunization initiatives. There are regulatory hurdles, legal safeguards, and institutional checks that prevent one person, no matter how influential, from rolling back decades of public health policy overnight. The CDC, for example, operates on established science, peer-reviewed research, and advisory committees that include leading experts in immunology and epidemiology. Any change to vaccination schedules or immunization policies would require rigorous evidence, public hearings, and multi-agency review. So unless RFK Jr. has some magic wand that bypasses Congress, the courts, and the entire federal health systems, this idea he'll single-handedly ditch vaccinations is pure nonsense. It's appeal to fear, not a real-world scenario. Now let's talk the numbers game, because Adam conveniently throws out global measles statistics to stoke panic while talking about American policy. Yes, measles is a serious disease that has caused outbreaks in some parts of the world where vaccination rates are dangerously low. For perspective, the World Health Organization reported over 9 million measles cases globally in 2022, primarily in regions with poor healthcare infrastructure and low vaccination coverage. Meanwhile, in the United States, vaccination has been remarkably successful, so successful in fact that measles was declared eliminated here in 2000. Now, to put in the context, the U.S. saw 121 measles cases in 2022, according to the CDC. That's 121 cases in a country of over 330 million people, a far cry from a global crisis. And these sporadic outbreaks are not evidence of systemic failure. They've been linked to specific communities with low immunization rates, often due to religious, cultural, or personal exemptions. This is not a collapse of vaccination programs. It's isolated pockets of lower coverage, not the entire country turning its back on vaccines. The CDC's data further shows that more than 90% of American children still receive the MMR vaccine on schedule, a figure that has remained consistently high for decades. So while global numbers are alarming, in the U.S., measles remains a rare disease precisely because of our strong vaccination infrastructure. Pretending RFK Jr.'s leadership will somehow plunge the country into a measles pandemic ignores the actual data and reduces a complex issue to nothing more than a scare tactic. RFK Jr. is often framed as someone out to end vaccines, but let's clarify. His critiques have often focused on vaccine safety and transparency, particularly on how pharmaceutical companies and regulatory bodies handle safety data. You can disagree with his positions, but that's not the same as dismantling immunization altogether. To conflate raising questions about vaccine safety with letting measles kill millions of children is not just a straw man argument, it's lazy fear-mongering. And let's be honest, the media silos problem cuts both ways. The claim here is that Americans are primed to believe RFK Jr.'s misinformation because of the media they consume. But isn't that exactly what's happening here? You're being told to panic without evidence, to treat RFK Jr.'s leadership as the literal end of science, and to ignore the fact that skepticism, when done responsibly, has always been part of the scientific process. You're being sold to outrage instead of facts. Here's a real issue. If science communicators have failed to earn the public's trust, maybe it's because they've spent too much time talking at people instead of listening to them. RFK Jr. didn't become a prominent voice out of nowhere. He represents a segment of the population that feels ignored, dismissed, and shut out of the conversation. Attacking him with cartoonish hyperbole doesn't change that. It just makes his supporters dig in further. So let's stop pretending RFK Jr. is some existential threat to science itself. He's not a dictator. He's not a virus. He's a skeptic who will have to operate within the same regulatory systems, legal checks, and scientific standards as anyone else. If those institutions are as strong as they claim, they'll hold up under scrutiny. And if RFK Jr. raises legitimate concerns that push for more transparency, better communication, and greater public trust, that's not the end of science. That's science working as it should.
So a lot of people in the medical establishment are asking, why is this happening? Why is medical misinformation ascending to the highest level of government? I mean, America has the most advanced medical science and technology on the planet. Even the Yakuza come here when they need a new liver. So how did we end up in a place where our nation's healthcare system is about to be run by an anti-science, conspiracy-obsessed lunatic? Well, the answer is pretty simple. It's the same reason that Americans are celebrating Brian Thompson's violent death. It's because our healthcare system sucks ass. 4 in 10 American adults report being in debt due to medical bills. Half of Americans can't afford healthcare at all. In comparison to every other wealthy nation, we have the worst health outcomes and the shortest lives, and yet we pay more than anyone else. 17% of our entire GDP is spent on this shit, and we're still not fucking healthy. In other words, while we might have the world's most advanced medical technology, we have the world's least advanced social technology for distributing it. What good is it to invent an incredible new medical therapy when no one but literal crime bosses can fucking access it? So, the medical establishment might be shocked that Americans are turning away from science and towards conspiracy theories and quackery, but honestly, it makes sense. If your whole experience with the system is jumping through endless hoops, being denied for coverage, and watching your friends and family members sicken or go bankrupt, why would you give a shit what the NIH or the CDC say, even if they're right?
Adam is throwing a lot of numbers around. 4 in 10 adults in medical debt, 17% of GDP spent on healthcare, and while these are real numbers, they're incomplete. Yes, the U.S. spends more on healthcare than any other wealthy nation, and yes, our outcomes lag behind, but that's not a failure of medical science. It's a failure of healthcare delivery caused in large part by overregulation and administrative bloat. The system is weighed down by layers of red tape, compliance costs, and bureaucratic inefficiencies that make it harder and more expensive for patients to get care. For example, a 2022 study by Health Affairs showed that nearly 25% of U.S. healthcare spending goes toward administrative costs, far higher than in other developed countries. Hospitals, doctors, and insurers are drowning in paperwork, compliance rules, and billing requirements that add no value to patient care but drive up costs for everyone. Even physician salaries, which are nearly double what their counterparts in Europe earn, add to the burden. Not because doctors shouldn't be well compensated, but because their wages are often a reflection of navigating a complex, overregulated system. And let's address the idea of only crime bosses accessing care. A bit of hyperbole that's great for dramatic effect, but terrible for clarity. The fact is 91.7% of Americans have health insurance as of 2023, according to the CDC. Millions still face gaps in coverage, and affordability is a huge issue, but the system is far from being completely inaccessible. Pretending otherwise ignores important progress and feeds a narrative of hopelessness that just isn't accurate. Now, to the core claim that it makes sense for Americans to turn to conspiracy theories and reject science because the system has failed them. No, it doesn't. Frustration with healthcare doesn't have to mean rejecting evidence-based science. You can distrust the system, the insurance denials, the skyrocketing costs, the endless bureaucracy, without dismissing the very science that underpins modern medicine. But here's what's really behind Adam's argument. He's trying to paint a broad swath of Americans who are skeptical of our healthcare system as irrational while ignoring their legitimate concerns. All in all, it reduces complex frustrations that millions of Americans have to a binary choice. Either you accept Adam's perspective or you're out of touch with reality. That's not analysis. It's a condescending, partisan, and elitist take that dismisses real anger and real problems. If anything, it reveals a refusal to engage with the perspectives of people who are demanding solutions rather than easy scapegoats.
Remember during the COVID vaccine rollout, we were all told to bring any questions about the vaccine to our doctor? Well, A third of Americans literally do not have a doctor because they cannot afford one. So of course conspiracy theories about the vaccine spread. Americans had no one reliable to talk to about it. Instead, we were all forced to do our own research on the internet. And when that research led us to quacks and grifters like RFK, well, at least those quacks were acting like they cared and peddling a fake cure that didn't work, but hey, at least you could buy it at the local horse supply shop. The desperation produced by the American healthcare system is causing Americans to take matters into their own hands, whether that means elevating a nut job like RFK or literally grabbing a gun and enacting vigilante justice in the street. And let's be clear, neither of these things are going to do a whit of good. RFK Jr. is not going to fix American healthcare, and murdering a CEO is not going to fix the health insurance industry. But both events are the fault of the entire American medical system, from United Healthcare to the NIH to the politicians who refuse to fix the problem. They have failed to take care of the people of this country, and this is the result. But you know, it doesn't have to be this way. In this country, we have enough money, we have enough resources, and we sure as shit have enough science and technology to extend healthcare to every citizen who needs it, regardless of their means. A majority of Americans believe that the government should do so. All that we have lacked is the political will. Instead, we've spent decades allowing filthy, rich, out-of-touch wealth hoarders like insurance executives and hospital chains mine our bodies, our health, our very lifespans for their fifth goddamn yacht. And if we don't make a change, if we don't see the murder of Brian Thompson and the rise of medical pseudoscience as the canary in the coal mine that it is, and start listening to the people of this country, well, pretty soon, this whole place is gonna blow the fuck up.
Now let's take a moment to appreciate the irony here. Adam claims to be calling out conspiracy theories, yet in the very same breath, he peddles misinformation with the confidence of someone who thinks shouting louder makes them smarter. Horse supply shop? Really? Are we still doing this? The whole ivermectin is just horse medicine line was debunked years ago, but apparently the leftist talking points still haven't updated. Yes, ivermectin is used as a veterinary drug, but it's also an FDA-approved human medication that has been prescribed for decades to treat parasitic infections. Now, while its effectiveness against COVID is questionable, spinning it as horse paste is a classic straw man rhetoric. Mock the fringe users while ignoring the actual context and history of the medication. It's lazy, it's dishonest, and it reeks of the same misinformation Adam claims to despise. And here's a kicker. While he's ranting about Americans turning to quacks and grifters, he's simultaneously pushing the tired leftist fairy tale of universal healthcare as if it's some magical cure-all. Spoiler alert, it's not. Let's be clear. Universal healthcare sounds nice in theory. It's an easy pitch. Healthcare for all, as if saying it somehow makes it feasible. But in practice, it's a bloated, inefficient disaster. If you want proof, you don't have to look any further than beyond our own borders. Just look at the failures right here in America, as we saw a few moments ago in this video. And because this is the reoccurring pitch of the left, let's dive in even a little deeper than we did before. Take California's single-payer proposal, for example. It was projected to cost the state $400 billion annually, more than twice California's entire budget, according to a 2022 analysis by the Tax Foundation. Even its biggest champions admitted it was financially impossible without crippling tax hikes, including a 15% payroll tax increase and additional levies on businesses and individuals. To put it bluntly, the system was unsustainable before it even started. Then there's Massachusetts, which implemented Romney Care, the closest thing to universal health care we've seen in the U.S. Costs spiraled out of control, requiring billions in federal bailouts, while premiums continue to rise faster than the national average, as reported in a 2011 Heritage Foundation analysis. If these are test runs for universal health care, it's clear the results don't justify the promises. And what about Canada or the UK, supposed universal healthcare success stories? Their systems are plagued with inefficiencies, wait times, and crumbling infrastructure. According to the UK's National Health Services, data from early 2024, patients have waited over 18 months for elective surgeries, with a record-breaking 7.6 million people on waiting lists. In Canada, the Fraser Institute reported in its 2023 study that patients waited on average 27 weeks for specialist care, the longest delays recorded in over 2 decades. These delays often result in worsened health outcomes as patients must endure months of waiting to receive even basic treatment. But the problems don't stop with wait times. Universal healthcare systems rely on cost control measures that restrict access to innovative treatments. According to a 2023 Commonwealth Fund report, Americans enjoy better access to specialized care and newer treatments compared to countries with government-managed healthcare. For example, cancer survival rates for breast, colon, and prostate cancers in the United States are significantly higher than in Canada or the UK. A 2021 study published in The Lancet Oncology found that 5-year survival rates for breast cancer were 89% in the US compared to 82% in the UK and 84% in Canada. The difference is simple. Universal systems prioritize cost saving and rationing, while the US emphasizes innovation and access to advanced therapies. And here's where Adam's argument becomes particularly misleading. He cites a 2020 study showing that 63% of Americans support universal health care, conveniently ignoring more recent data. According to a Gallup poll from late 2022, support for the government ensuring healthcare coverage dropped to 57%. Showing a decline as Americans become increasingly aware of the cost and trade-offs associated with these systems. A 2024 Sacred Heart University survey also revealed that while over half of respondents believed universal healthcare could expand coverage, 28.5% expressed concerns it could strain the system and worsen patient outcomes. Adam's selective data cherry-picking paints an inflated picture of public enthusiasm while ignoring the growing skepticism of universal healthcare's practicality. Here's what this means for everyday Americans. Universal healthcare doesn't magically make care better. It just shifts the burden. Instead of paying out of pocket, you'll pay through significantly higher taxes and endure longer wait times for essential services. According to the OECD Health Statistics Report from 2023, countries with universal systems experienced severe underfunding and resource shortages, leading to crowded hospitals and delayed treatments. For example, in Canada, 30% of patients wait over 4 months for elective surgeries, compared to less than 5% in the United States. And those free services, they're anything but. Every dollar comes from taxpayers, whether they're using the system or not. The bottom line is this. Universal healthcare might sound compassionate, but in practice, it's a bureaucratic nightmare. California couldn't afford it, Massachusetts couldn't sustain it, and Canada and the UK are struggling to keep their systems afloat. A government-run system would mean higher taxes, rationed care, and fewer options when Americans need treatment most. As the data shows, the trade-off for free healthcare is a steep decline in quality, access, and outcomes. And the price isn't just financial, it's measured in lives. Adam's one-sided portrayal ignores these realities, but Americans deserve the full picture, not just talking points. So here's a big question. What does all of this mean for you? We went from Luigi to RFK, only to land at Adam claiming that universal coverage is the magic bullet to fix everything wrong with healthcare. But Massachusetts and California tell a very different story. If costs are still unaffordable, even where nearly everyone's insured, are we really solving anything or just rearranging deck chairs on a sinking ship? Why do premiums and bills keep rising, even as coverage expands? And why does having insurance still feel like a luxury you can't afford to use, even in places with universal coverage? At the end of the day, this is what it comes down to. The left doesn't want you to control your health care. They'd rather take this horrific act committed by a deranged individual and twist it into a narrative that pushes for even more government control over your life. Universal healthcare isn't the solution they promise. Look at countries with government-run systems, delays, rationing, spiraling costs, and people still slipping through the cracks. Meanwhile, here in the US, they'll drive up costs even further, pass the bill to you through higher taxes, and call it progress. So ask yourself, when they're celebrating a murderer and demonizing anyone outside of the establishment, is it really about helping you, or is it about grabbing power? Don't be fooled. The system is broken, yes, but turning it over to bureaucrats and stripping you of your freedom to choose isn't the answer. Isn't it time we stop swallowing these dishonest narratives and start demanding real solutions that actually put you first? Anyway, you tell me what you think in the comments down below. Have a terrific day. Peace.